aneurysms are not associated with the SCAD location of where the dissection was. If someone has an aneurysm, it's found in a different blood vessel. So the aneurysm doesn't go away. An aneurysm is an outpouching of the blood vessel from the blood vessel wall being weak. And we know that if they get to certain sizes or other things, they're at risk of tearing and causing bleeding. The place that we think about it the most is up in the brain. And so that there are ways to treat that. They can do surgery, they can do coils, they can do some stenting, they can do other things. And usually it depends on the size of the aneurysm, the location of it, and it's usually following with serial imaging to see if it's getting bigger or what's happening with it. And so it's not usually at the site of where a dissection is.
Dr. Best is truly the best. Greetings from Delaware. That's sweet, thank you. And then also there was a comment too that Dr. Best said that this was more informative that they got from going to their cardiologist. So.
Very sweet.
Very enlightening, appreciate that. You had a slide about chest pain, and I had a question about that. My wife had her SCAD 3 months ago, and chest pain is something that's kind of bothering her. It kind of goes up and down on a day-to-day basis. So wanted to understand, are there any specific tests that you recommend to go after to check out the chest pain, or is it something we expect to get better over time?
So if someone's having chest pain after their SCAD, then you should be evaluated for that, okay? The evaluation can take several forms, so it a little bit depends on more how your symptoms are presenting. So you can look for pericarditis, so inflammation around the sac of the heart. You can get that with a heart attack, and so that's usually a more constant kind of pain, and typically alters with breath holding, but doesn't have to. There's chest pain that comes more around menstrual periods. There's chest pain that can come from other things, in blood vessel reactivity, and so that some of it has to be doing further testing to look for other causes, and then some trials of medications typically, whether or not nitroglycerin makes it better, etc., to try and figure out the cause. It also is important to make sure that there's no issues related to the blood vessel that was the cause. So sometimes if the blood vessel wasn't treated, so whether or not the dissection persisted, or if a stent was put in, whether or not there's a problem around the area of the stent.
Okay. Any more in the room? Oh, coming.
Thanks for taking my question. Mine left permanent damage in my left ventricle, and my question is, I'm unwilling to accept permanent. Is there any research being done that could possibly revive these areas, or surgically, not so much with medicine?
Yep. There's been lots of work trying to, get part of the heart to grow back. There are not things that are there yet, but there have been a number of different stem cell studies and other things working to try and make that happen. So I don't know if and when those things will actually happen, but there's certainly been research on that. It hasn't been related to SCAD, but just related to heart attacks in general. I know that there's a study that's starting at Mayo related to congenital heart disease, where the heart muscle is weak related to those kinds of things. And so
They said that's in my future.
and so there's all kinds of different options, and cardiology and medicine in general has been changing so rapidly that it's amazing what 5 years will bring, or 10 years, and so that you have to be a little bit in awe of what kinds of things can be done now that weren't ever possible before. And so I don't know what's going to come with that. I know that things continue to improve as far as different things that can be done to left ventricular assist devices, cardiac transplant, other things that can be done to help along the way. Trials ongoing that are looking at aspirin. So this far out, I don't know that there's and a clear benefit to being on an aspirin. Lisinopril will have two benefits for you. One is if you had a big enough heart attack that it affected your heart pumping function, and if that was reduced, we usually leave you on lisinopril. If it was a small heart attack and that didn't occur, then we don't. Then the lisinopril is also, it lowers your blood pressure. And so if you need it for lowering your blood pressure, then that is also helpful from that standpoint. So those are my answers, and that's as generic as I can make for answers on all of those fronts.
What percentage of dissections never heal?
We don't know that for certain. We think it's probably down to the 10 to 15% range. So the majority of them seem to heal. How we have data on whether or not dissections have healed is that someone who's had a dissection, if they went back and had another angiogram for another reason, we've looked at it. So it's fairly low, but it's not 100%, and so we have seen dissections that persist.
Understanding that there is a lot more research that needs to be done and is currently being done. There are so many SCADs that are not FMD or vascular abnormality related, and given the recommendations for no hormone replacement therapy and the postpartum patients and the age range of 42 to 52, can you speak more to this thing that comes out of nowhere, and is there research and more known about, is this hormone related? Like, why does this dissect out of nowhere if you don't have vascular abnormalities? Like, can you speak a little bit about what the aims are with research related to that?
So there are definitely things, there's a lot that we don't know. And I always think that there is a systemic factor, systemic meaning throughout the body factor, that's going on when someone has a SCAD event. So we think that there's something triggering it, and so that when you think about it, why would you have a dissection in two different coronary arteries that aren't like physically located right next to each other? And then we've also seen patients who had a dissection in the heart along with a dissection in another blood vessel at the same time. Okay, so that there's something systemic going on. And we think that it's probably in people who have weaker blood vessels associated with some sort of triggering event.
So when you say systemic, are you talking about like catecholamines and stress response hormones, or like when you say systemic, like?
So systemic means something throughout the body.
Right.
Now what that is, I don't know. Okay, so I'm not going to make you more satisfied, sorry. But things like catecholamines would be a systemic response. You are correct on that. So understanding what things that could be throughout the body that could be triggering it. And so that's why some of the information, like trying to figure out better how the catecholamines are working, like Dr. Tweet's next study is looking at some of that to see whether or not people with SCAD have some differences in some of their autonomic function is important.
Thank you.
Can you talk do you have any connections with esophageal spasms and SCAD?
Not that I know of. Sorry, that was all the answer. So just because I don't know of any, so it's hard because the answer is sometimes people just have two different things going on and it just happens. And whether or not there's an association, I have no idea. I haven't seen anything written about it, nor do I know about anything, but I also don't know that anyone's ever looked.
Can I just, it's okay, can you guys hear me okay?
No, they can't on the video.
They can't on the video. Sorry, Ellen.
That's all right.
So my question is, you were talking about troponin levels, and I remember something you brought up, and you mentioned it tonight too, the first time when I went in my only scan. Initially, they were like, oh, you're fine, and then they ran another test like 2 hours later, because I said, I do not feel good. And then the troponin levels were much
So
higher.
you were in that 20% group who their initial troponin wasn't positive.
They said you're do they, when you go in for a different type of heart attack, are your troponin levels instantly,
No.
so it could happen, okay, so, because
So
they
it's
look
the
at you
same
like you're
thing.
kind of, okay, so it's the same
So
thing.
it's the same thing, but they eyeballed you and said you're a young woman who doesn't look like someone who should be having a heart attack, and your initial troponin was fine, so I'm not gonna worry about it, and so you shouldn't either, and so the fact, so this is what I was talking about of
They give you
advocating.
the look, they
Yeah.
give that look, like,
Yeah,
you're fine, right?
yeah, no, right. Mm-hmm.
Somebody said that, and maybe they're right, I'm not sure, that they're saying that a non-STEMI is small and a STEMI is big. Is that, I mean, I've heard it different than that.
Yep, a STEMI is an ST elevation myocardial infarction. So on the electrocardiogram, the little blips, one of the areas is elevated, okay? And so that's how you see that it's an ST elevation myocardial infarction. And so you can see it off of the ECG. And traditionally, when someone has that kind of heart attack, they need to go get treatment right away. And so typically, we bring people to the catheterization laboratory. If not, they might get thrombolytic therapy if there's some place that they can't get to a cath lab, but most of the time people go to a cath lab. And those patients need to go right away, and so that we have parameters by which we get people to the cath lab in pretty short order.
Do you have any questions? No, second.
I think I do too, so, yeah.
For the recommendations for exercise, is that just for forever for anyone with SCAD, or you can slowly start to work up to some things? For example, like the yoga.
So yoga is not yoga, you know, there's different types of yoga. Right, so, you know, hot yoga, probably not, you know, things, basically, it's, when someone tries to tell you how much you're allowed to lift for strength training, no one should ever give you an exact amount of weight, because as you continue to exercise, you get better at it. The same is true for yoga. And so that as you're continuing to do things, you can hold things longer, again, without straining as much. And so it's mostly trying to listen to your body and trying not to strain and other things. And so you just don't want to be holding your breath for long periods of time. And so that's primarily the yoga answer. So, you know, gentle yoga, lots of us can do that. The more complex things, you have to kind of just take it a little slower than everyone else and build yourself up slower.
Any more questions here?
One, so I started exercising with Orange Theory a year ago, so I'm 5 years out.
Mhm.
But what I've noticed is I usually have a really low blood pressure,
Mhm.
low heart rate. But when I'm working out, it can be like 170.
So blood pressure when you work out, everybody's goes up when they work out. So that's normal. 170 is still going to be normal. So in order to have exercise-induced hypertension, it usually has to be higher than that. So there is an age calculation to all of that. But 170 wouldn't surprise anyone.
Okay. And then my second question is, I have 2 daughters.
Mm-hmm.
Is there any way of knowing if they're at risk?
So usually when someone does genetic testing looking for vascular abnormalities, vasculopathies that are genetic, it's only if you find something there that you will better know for what to screen your daughters for. Otherwise, we don't have any specific things that you need to be looking for.
Okay, so, and I did read an article that there was some genes that they had done some testing and
Yep.
thought that there was some connections.
Yeah, so there's been some genes that have been identified, but they're not yet something that's diagnostic for SCAD. So that when we find some genes that are associated with it, it's not like you can go in and get that one blood test and know for sure if you're going to have SCAD. And so that it's, unfortunately, it gives us hints at it, but it's not yet something, especially when there's multiple genes involved, that it's easy to make a diagnosis with.
questions? Okay, oh, coming.
I had my SCAD in 2006, and at that time I had a quadruple bypass, and I didn't see anything about the percentage of people that have bypass surgery.
Yep, that has probably changed over time, and so that I suspect that surgery is going down with SCAD. One of the reasons that it's not as ideal is because the grafts will close over time or can close over time, and so that there's a much higher risk of grafts closing in someone with SCAD. What happens is that in order for the graft to stay open, your body needs to need the blood flow to go to that area. And if the SCAD area heals up, which the majority of them do, then that graft is no longer needed, and so that there isn't good flow down it, and that makes the graft close up. And so that we know that there's a high risk of graft closure, and so that's one of the reasons we usually try and avoid bypass surgery if at all possible. But if someone has very proximal disease, large dissections, other things, then sometimes that's just what you need to be doing. And so we still will send people for bypass surgery, it's just not as common, and so it has been going down in frequency.
So there's a couple of questions here that are asking for personal, and I just wanted to, I don't know much you want to answer them, but usually Dr. Hayes doesn't ask, they're asking, I can ask you if you want.
I'll try and make it more general as I
Okay.
can.
Okay. So I took triptans for 6 years to treat migraines, stopped taking them in April of 2023, and had my SCAD STEMI late May. Is there any evidence that long-term use of triptans weakens the artery wall? If so, is there any knowledge about strengthening of artery walls after discontinued use of triptans?
So there's no data on that. Triptans we know can increase constriction of some of the blood vessels, and so usually are discouraged because of their impact on the blood vessel wall, and so usually anyone who's had a heart attack will usually stop the triptans.
I have more here, but there's inside. Who else? Oh, here we go.
Thank you. I have a couple. Since we're not supposed to exercise in heat, can we do saunas, like infrared saunas or saunas out, like?
Usually shorter periods of time, and so, you know, basically all of those things to just keep things more limited in time frame.
You mentioned something just at the very beginning about arterial arrhythmias with SCAD?
Atrial arrhythmias, yep.
Okay. Irregular heartbeat?
Yes.
Right, that's happening?
From the top of the heart, yes.
Okay. Can you tell us any more about that?
So higher frequency associated with that, yes.
And we need to be concerned if we're doing that and it's happening?
So something to be treated, basically, if it's happening.
Okay, one more, sorry.
Okay, sorry.
You told us to advocate, right?
Yes.
And what is a way, since you're a cardiologist, can I ask this, what is a way to how do we advocate for ourselves and also bring cardiologists updated info, like, where do we?
Yep. So the first thing is that any doctor you have should be open to getting a second opinion if you have questions or some concerns over care. Even being at the Mayo Clinic, I still have people who say, hey, I want another opinion. I help them get whatever opinion they want. And if your doctor's not open to that, then that should be a concern. And so that, I've gotten second opinions for patients within Mayo and outside of Mayo. And so, so that's one thing. Advocacy sometimes is really important in the emergency room, and that's one of the places that I just hear it so often where you're like, someone wasn't taken seriously, and sometimes you just need to be pushy of like, well, what's my troponin show? Oh, it's, no, we're not going to leave after just one. We want a second one. right, and so sometimes just questioning. And then oftentimes actually, doctors who don't know a lot about SCAD oftentimes are really thankful when someone gets a second opinion over with the SCAD clinic, because then they have an outline of what to be doing. So, I hope that was helpful.
Here's well, I'm getting my steps in. I won't swear. Okay, yeah. Do we have a delay?
Hi, nice to meet you.
Nice to meet you too.
I was 38 when I had my first SCAD, and my only SCAD that I'm ever going to have. It's not going to come back. And it's been 10 years, medically treated. I'm totally fine. I haven't seen my cardiologist since, but I'm on baby aspirin and lisinopril since for the last 10 years. Can I ever come off of it?
So, aspirin is having a greater debate right about now. So, some time ago I would have said on the aspirin front that there's no data on the utilization of aspirin other than if someone has a stent, and that all the SCAD groups are doing it. There was a retrospective study that
Hi, this is Marilyn Shelton, author of Halloween Pandemia and Christmas Pandemia. They're available on Amazon.com, both of them, and they're a series for young adults. And it's sort of a post-apocalyptic type series just based on survival, trying to survive during the pandemic and the holiday season, the various respective holiday seasons, Halloween and Christmas. So Halloween is book 1, and Christmas is book 2. And I really love my latest book, Christmas Pandemia, because I like the way the glossy cover turned out, and the various photographs of the Parisian landmarks also turned out well. They take up the whole page, and I just like the author page in the back. And both of these books are available on Amazon.com, Halloween Pandemia by Marilyn Shelton and Christmas Pandemia by Marilyn Shelton. And so, yeah, they're on Kindle too. Go get them today. I'm sure you'll enjoy this Apocalypse series. And so thank you. Christmas, the sequel to Halloween Pandemia. Cynical, foul-mouthed Felix Winchester, embittered by pandemic indignities, heads to Paris to get more healing serum and get back into the world after lockdown. While doggedly avoiding his old chemistry teacher like the plague, Felix finds snippets of French history, good food, and frothy Parisian fun slowly warm his tightened, injured heart as he learns that hope for the new world in the new year starts with him.